It is time now for Medical Rounds, and today we're talking about the COVID vaccine distribution and vaccine safety. And joining us to shed some light on all of that is Dr. Faiqa Cheema. She is the Assistant Director of General Infectious Disease at Hartford Hospital. Doctor, thank you so much for being with us.
Thank you for having me today.
So how do you think the vaccine distribution is going in Connecticut, especially in light of the new system?
So far, we know that 214,000 Connecticut residents have received the vaccination, of which at least 62% are 75 years and older. So that's good news. In addition, at least 12% of the Connecticut residents have received at least the first dose. So in my opinion, compared to other states, I think we're doing fairly well, but there is still room for us to ramp up the vaccination process, especially when we think about Connecticut residents who are immunocompromised or have history of cancer undergoing chemotherapy, are on lifelong anti-rejection medications, and are heavily immune suppressed. So we need to get these people vaccinated as quickly as possible and get the vaccines into their arms.
Absolutely. There's definitely a lot of people with underlying conditions who are wondering when they can have a priority. There's also an element of mistrust and hesitancy, especially in the Black and Latino communities, about this vaccine. Why is that, and can you change it?
Well, the answer to that question is so complex. I think when you think about mistrust, it runs a generation deep in these minority community. And a lot of it is rooted in, the social inequities that these minority communities have been facing over several decades. We do know from the data that we're seeing from COVID-19 that the Black and the minority community are twice as more likely to have complications from COVID and die from COVID. So we need to work really hard in engaging with these communities in a manner that they feel is acceptable to them, because it's really important to earn their trust and get the vaccines to them.
And quickly, about 30 seconds, what should people know about the vaccine safety?
The one thing that we do know is, based on science, that the vaccine is not only efficient, but it's also very safe. You do have some reactions, such as a pain in your arm, body aches and headaches, but they fade away by day 3 and day 4. It's important to remember, and a point that I want to drive home, is that the choice not to take a vaccine is also a choice in itself. You're basically saying that you feel safer taking your chances on a highly deadly virus that has killed more than 500,000 people in the United States.
Yeah, there is a risk and benefit for every decision you are making. Thank you for educating the folks who are listening. Thank you so much, Doctor, for being with us.
Thank you for having me.
Hartford Healthcare's free webinar series is a place you can learn more. COVID-19 vaccine, what you need to know, and it's being presented on February 24th. That would be today, and also March 3rd and March 10th from 6:30 to 8 p.m. To register, just visit hartfordhealthcare.org/virtual classes, or you can call the number you see there, 855-HHC-HERE.